There, this is Dr. Sam from Sunshine Pediatrics. Today I wanted to talk to you about asthma in kids. What is asthma and who is at risk for developing asthma and what triggers asthma. So asthma is a chronic condition of the lungs where lungs are reacting to certain triggers. So what happens when a kid is exposed to those triggers is the airway kind of gets narrowed because the muscles around the airway constrict, and also there is increased inflammation and swelling of the inside of the lining of the airways, and there is increased mucus production. So that makes the airways to narrow and kid develops asthma symptoms. Basically it can be cough could be during daytime or nighttime or both. It could be with activity, wheezing or some whistling sounds when they are breathing, or chest tightness or any shortness of breath. These are all the various symptoms of asthma. Not every kid needs to have all the symptoms, and it could be from mild to severe symptoms. So who is at risk for developing asthma is there's a strong genetic predisposition. So if there is a parent or a sibling with a family history of asthma, that's a big risk factor. And premature babies, they are also, or low birth weight babies, they are also at increased risk for asthma. And if someone had a bad RSV infection when they were an infant, that also is a big risk factor. Who are around tobacco smoke, like it could be second-hand or third-hand smoke exposure, they are at risk. And also kids who have food allergies or environmental allergies, especially to either pollen or even kids who have eczema. These are all at increased risk for developing asthma. Doesn't mean that all of them need to develop, but that's a risk factor. So there are certain triggers for asthma. The main common trigger is viral infections. Common cold causing viruses like rhinovirus or flu or parainfluenza. These can be triggers for asthma. Other thing is like cold air or sudden change in temperature. They can also trigger asthma. And indoor allergen exposure, especially like any pet dander, roaches, mice, cats and dogs. If someone is allergic to those, they can trigger asthma. And exposure to outdoor allergens, especially pollen from trees, grass or weed, that can trigger asthma also. Other triggers can be mold, or even sometimes stress can induce asthma flare-ups, and exercise or physical activity can trigger asthma-like symptoms, especially within 5 to 20 minutes after starting doing the activity. So it is very important to identify what are the triggers for asthma so that we can avoid those frequent flare-ups and make sure the asthma is under control. Thank you.